Dr. Julian Tang is a consultant virologist and honorary associate professor at Leicester University. He explained what's behind the rising number of COVID cases across Europe.
First of all, the Europeans didn't start vaccinating as early as the UK, so there are those who are still just singly vaccinated, and that gap in the vaccination wall, if you like, might allow the Delta variant to get through. We know the Delta variant actually needs more antibody from these older vaccines, first-generation vaccines, to actually give protection. And also the waning immunity from those who've had 2 doses are also kind of interspersing with this first dose vulnerability. And also the Europeans have a larger proportion of people who are refusing vaccination for various reasons.
We've heard the boss of AstraZeneca saying that the reason that Europe is doing worse than the UK when it comes to COVID is because it didn't use that particular jab. Does he have a point?
I think the main thing is that the UK was earlier in the vaccination programme. Now there's a lapse in terms of vaccine waning immunity after the second dose and before the booster doses here, whereas Europe's still catching up with that second dose. But also the UK is not seeing small numbers of cases every day. We're still seeing 30 to 40,000 cases a day with about 1,000 hospitalisations and about 100, 200 deaths per day. That might be the norm going forward across Europe once they reach the kind of same level of vaccination going forward. And this might be the seasonal burden of coronavirus in the future.
There is still a debate, though, isn't there, over how long immunity lasts from COVID vaccinations. So how crucial are booster shots in dealing with this latest wave?
So every virus vaccine with every virus has a variable amount of and duration of immunity depending on the individual host responses. I think that's a very large variable, and it's going to be very hard to pin down for any particular population. If you assume that vaccine immunity is going to last 3 to 6 months, as we've been seeing, I think that's a reasonable ballpark. They're trying to get down even more detail to that, like, to 50 or 60 days for every individual person. I think that would be inaccurate because there's too much variability, and the host immune variability is notorious, as we know.
And we're seeing countries like Austria going back into lockdown, others talking of stronger restrictions. Is that the right move?
I can't say whether it's the right move or the wrong move for different countries, but we've seen the outcome. If you delay the lockdown too long, you get a more prolonged peak, a higher peak, and more hospitalizations and deaths, unfortunately. If you lock down early, what suffers then is the economy and the social, psychological welfare of the population, and there's lots of rebellion against this, I know, in Europe as well. So it's really a balance for those individual governments to make care of the population from a virus point of view, and perhaps then you have some fallout from the social, economic, psychological welfare from other angles of that lockdown.
Just today, people in Northern Ireland are being told to work from home again if they can. Is it inevitable that the rest of the UK follows suit?
I don't know. It's hard to tell. I think there will be a surge in cases towards Christmas New Year, as we saw last year, because of the social mixing, the celebratory shopping and parties that we're seeing. I don't know what the threshold is now by the SAGE and government committees to then impose a lockdown. I think it may be higher than before because we're not seeing as many hospitalizations and deaths. But what that's going to be, I don't know.